Hello, everyone. This is Dr. Scot Haggerty. And in this really cool advanced training that we're going to be doing, we're going to be talking about self-care for a healthy pregnancy. And so, moms, if you're watching this, you obviously are concerned about making sure that you have an amazing pregnancy and you want to find out all the tools necessary so that you can have the best experience, the best pregnancy, max health. So what we're going to do in this two-part training is we're going to start breaking down the essentials that you need to know so that you can have the pregnancy that you want. Now, in each one of these sessions, we're going to go through and break down individual strategies. We're going to go in depth. The goal is to give you strategies that you can use and apply immediately. So if you're pregnant and there's things that you're not doing, add them in. If you're thinking about becoming pregnant, then this is a great resource to use as a tool to start building your library of things that you can implement during the course of your pregnancy. So I'm going to go ahead and pull up our presentation today, and we're going to dig into specific strategies that we can utilize right away here. So give me 1 second here. We'll get this all loaded up, and we will go ahead and get our screen loaded and good to go. Just 1 second here, everyone. Get everything set up here into presentation mode. And we are good to go. All right, so let's go on into presenter mode. And as we go through here, I want to make sure that we obviously are seeing everything. So if you have any issues with seeing any of the graphics or anything like that, let me know. So as we go through here today, ladies, I want to go through and just start with just a basic foundation. So this is part 1 of 2. There is going to be a lot of information that we're going to go through. So in the Facebook event page, there is a notes page. Okay. I hope at this point you've had a chance to go and pull that down, start taking some notes on that. If there are things that you miss, we are going to have this live on replay here on Facebook, so you can come back and watch it. But if there's specific things that you'd like to learn about, specific things that maybe you'd like us to have spent more time on, then you can feel free to go ahead and ask. So let's go ahead and jump in and get started. So as we talk about this first, I want you to understand that self-care during pregnancy is vital to not just your health, but to the baby's health. Prior to delivery, very few expecting moms that we know of are ever told to plan ahead for what motherhood will be like. Most of the emphasis is on the delivery and the birth, and what that leads to is many moms being completely overwhelmed during the first 4 to 6 months of the baby's life. Our goal today is to give you strategies to try and foresee that, but also make sure that as you're going through the pregnancy, you're preparing for what life will be like during pregnancy. So first, let's talk about how does your life need to change during the pregnancy to prioritize your baby? Well, let's look at some basic things that you want to start thinking about. Number 1 is you want to incorporate downtime with your baby and be still. And what that means is, this can help with in the early days of motherhood when you experience how much time and energy caring for a newborn really does consume of your day. It also helps with frustration of not getting a lot done except for caring for the baby. These scheduled downtimes help you just to kind of ease into the routine, getting used to planning out the time, knowing that once the baby's born, time is going to be at a premium. What activities can you add in to nurture yourself? Well, think about things like this, right? Some things you may do, some things you may not. Things like adding in candlelit baths with aromatherapy, going for evening walks, doing things like foot baths. These times when you're doing these evening walks and foot baths, they can be a really good time for you to connect and talk with your baby. There's lots of research out there that indicates and points to enhanced brain growth and development by talking to your baby during the pregnancy. So if you're not doing that already, I would encourage you to. And if you're not pregnant yet, make sure that's part of your routine. So start thinking about, what can I remove from my time that is not nurturing? So start thinking about slowing down, stop running around and doing things like during your lunch hour. Sit, eat lunch, relax, read a lighthearted book, keep your stress hormones as low as possible. You're going to hear this as kind of a repetitive theme about watching stress levels. And I'm going to digress for a moment on this because I want to make sure we hammer this point home. Moms, one of the reasons why this becomes so important when we talk about controlling stress is because when your nervous system is under a lot of stress, it can directly affect the baby's growth and development. It can also increase the likelihood of interventions during the delivery. And so since that's something that we want to have control over, it becomes increasingly more important that you do everything that you can to control your stress levels. If you are not pregnant yet, but are looking to become pregnant, start thinking about, how do I get rid of my stress and anxiety levels now? How do I get them under control if I have high levels? And a lot of these strategies can be used in modified ways prior to pregnancy, but making sure that you're getting plenty of exercise, taking time to meditate, taking time to prioritize yourself, removing stressors like having time where you're not looking at your phone, and having time where you just have straight up downtime, where you're disconnected, where your brain can shut off from everything and not be on overdrive. Because we know that the more on overdrive you are, the more cortisol you're going to produce, the more adrenaline you're going to produce. And when you're pregnant, that becomes a big issue, because that can alter the development of the baby's brain, and it can increase the likelihood of neurodevelopmental challenges afterwards, things like ADHD, things like sensory issues, and so on. Now, think about things like, what can we add to our weekends that are nurturing and help us to focus on our baby? So things like going for a walk in the park, things like going to the movies and having a nice dinner. Date nights are really important because they're probably going to be on hold for several months once you have the baby. I remember the very first time that my wife and I went on a date after our daughter Olivia was born. It was, going to dinner with a child is an event in itself, right? It was literally one of us held her while the other one ate, and vice versa. It's a challenge in the beginning, and we were thankful that we had some family where we lived in St. Louis who took Olivia for a night so we can go out for anniversary. So it was weird. We had not had a date at that point in time in months. And it becomes something that you get out of a routine of doing that. But it becomes something where you really want to prioritize your relationship going into the pregnancy so that you're strong, in a good place, healthy, because it's going to be a minute before you can get back into routines of doing those things once you have a newborn. Now, think about doing things like planning a pre-baby vacation or retreat. If this is not something that was on your radar, I would strongly encourage you to think about doing this if you are able. At around 30 weeks is really the best time to plan this, because you still are in a position where you can travel. And, obviously, without the exception of complications, you should be able to go and get a getaway in where it's not too risky for you or for the baby to make a trip. You and your spouse could really value this time, because it's a momentary getaway before you become new parents, where you can literally spend the majority of your time just, talking about what it's going to be like, talking about visualizing what it's going to be like to be new parents. Take time to, talk about your plans of how you're going to support each other. Things like this become so incredibly valuable, because if you come into the delivery and you two are not on the same page, it'll create stress. The more that you can take time like this, and especially intentional time where, get away to a cabin, get away to a resort somewhere, do something where you guys can disconnect from your work and your responsibilities in your world to just connect to one another again. And that attention to your relationship, that conscious effort of thinking about what life will be like once you guys are parents, will be more valuable than what you can realize. My wife and I spend a lot of time talking about what our post-baby life would be like. And, did we hit the mark on everything? No. But did we come in well prepared? Yes, because we knew what our expectations were. We talked about a lot of things. So when it became time for us to be parents, because we'd taken the time to think about this and take some time to ourselves and to visualize what it would be like to be parents, it was incredibly valuable. Reduce your stress. Now, you've already heard me talk about this once, but I'm going to beat this one home, because we're doing these advanced trainings for twofold. It's for your health, but it's for your baby's health. And you've heard me mention already about the adverse effects that stress can have on baby's health, but it can also obviously wreck your quality of life during the pregnancy. So we want to make sure this is always part of top of mind consciousness for you. From the beginning of the pregnancy, you want to start thinking about planning the exact point that you're going to begin maternity leave. The earlier you can, obviously, the better. And, depending upon where you're watching this, what you do for a living, that point is going to vary dramatically based upon your company's policies, financial situations, and things like that. 30 weeks would honestly, in a lot of ways, be an ideal because it's a transition point for your baby. Because after week 30, your child's brain is rapidly developing and is highly sensitive to stress hormones. And so minimizing stress now really becomes very important. So if you haven't thought about this, really kind of start planning out your strategies so that you know when you can, both with your work and financially, make this transition, okay? You'll need more rest in trimester 3, so planning for rest, getting more sleep, and not working crazy long hours becomes incredibly important. We think oftentimes of stress as just things going well and things being super stressful, but it's not just that, it's pace. It's long hours. It's all of those things that require you to get a second wind, meaning you're having to tap into your stress hormones. All of those things create stress in your body that it has a progressively harder time adapting to the further you get into your pregnancy. So being aware of this as a really crucial point of consciousness is important as you're going through your pregnancy. But really, the earlier on you can put this into your eyes and start thinking about planning this out, the better it's going to be. Planning for de-stressing and calming your body and brain prior to the baby's arrival is really critical for your health and the baby's health. Thinking about things like adding in things like meditation, adding in things like planned exercise, adding in time when you're not connected to a tablet or a cell phone, intentionally disconnecting. These things become really critical because the brain has to have breaks. And the more that we're on overdrive, the more that we are pushing, the harder it becomes for our brain to be able to achieve that goal. Structure your work. This is something that oftentimes is not mentioned when I talk to parents about planning their pregnancy out. But self-care is about analyzing all of the areas of your life, all of the areas of your work during the pregnancy so that you're able to control as many factors as possible. And so think about this, and this is a big one. What does your work situation look like after the baby is born? Think about, do you want to go back to your current position? Think about how soon you're going to return. What are your work options? Are you able to work part-time from home? Can you job share? Is there anyone else who's able to go and take some of the load off of you so that when you come back, knowing that you're going to be a parent for, potentially the first time, or, maybe you've got multiple children and your time is going to be even less. How can you split some of the workload into pieces so you don't have to carry as much? Is that an option? Ask those questions. You will be amazed at how open most companies are, right? I mean, we are a small business, and it's something that we've been very aware of, right? If our staff become parents, then there may be a need for us finding a way to try and distribute the job into different aspects of our practice, to different people, to maybe hire additional people, so that we can accommodate to making sure that mom's life is not excessively stressful, that she's got work-life balance. And it's a big part of focus for a lot of businesses these days. So if it's something that you're thinking about, have the conversation with your superiors. And if you're not, if you're the top of the food chain and you're the boss, then start thinking about, what can I delegate? A lot of people who are business owners and executives, if you're at the top of the food chain in an organization, it's really important that you start figuring out, what can I delegate away? What can I give? Who can I trust with this? And during the course of the pregnancy is probably as good of a time as you're ever going to have to start really implementing these things, finding out what life is like with having less things on your plate. But making this top of mind consciousness now becomes really important. And then obviously things like, what facilities are available for childcare. So starting to look into those things during the pregnancy becomes a big thing because you obviously don't want the stress of it after the baby's born when you're trying to figure out life as a new parent and get back into the working world, now trying to go and balance your family. It's a really good time to go in vet facilities. And, a good place to look on those is, go into a lot of parents groups. So go into parents groups that are similar in belief patterns to you, right? So if you are a crunchy mom and you're super holistic, well, you want to go and find a facility that is going to be really well aligned with your belief styles, making sure that the foods they're going to provide for snacks are going to be good quality foods, not a bunch of junk food. How do they align with things like what you decide to do with your vaccines? How do they align with what are their policies for food allergens? Making sure that the places that you're going to want to put your child in for childcare are very well vetted, well in advance. Facebook groups are great for this. You go on to any one of the Facebook groups. I know here in our area, you've got things like the Strongsville, Brunswick, and Medina Moms Discuss It groups, where there's tons of moms on there who are great, greatly willing to go and share information about their experiences, things that they've seen, goods, bads, and then they can help you to kind of whittle down the decision-making process faster. This is a big one. I actually just had a conversation with one of our moms about this the other day. And Julianne, if you're watching this one is very specifically for you. So when you think about morning sickness, right, a lot of moms just think that there's just nothing that can be done. Believe it or not, there are a number of different things that have been proven throughout time to be very effective strategies. And let me go through this. So, it's supposed to be a normal self-regulating process, and it can be terrible. Some moms experience it far worse than others. In most moms, by the end of the first trimester, things start to calm down, things become a little more stable, morning sickness diminishes, and then ideally goes away for the rest of the pregnancy and you feel pretty good. That's not the case for everyone. But there's two proven methods I want to discuss here that have been shown time after time after time to reduce morning sickness. Number one, be a grazer. Eat small amounts of food throughout the course of the day. Now, here's the reason. If your blood sugar starts to bottom out during the course of pregnancy, right? So, you've got your body that has a certain energy requirement and the baby's that has a certain energy requirement. Your baby is taking the food that you eat and using it as a source of energy. So, you've got two people eating, feeding off of one person's food supply. So your blood sugar levels are going to be a little more variable. The more stable you keep your blood sugar, the less likely you are to go and have the severe effect of morning sickness. So that means eating small quantities of food every 2 to 3 hours with an emphasis on foods that are low on the glycemic index. That's what you even see here in the background. I chose the image where it's fruits and fruits like apples and strawberries and even the salads. You want things that are slowly absorbed by the body, not fast absorbed. So if you want to do things like sweet potatoes, those are also excellent. Lots of vegetables. Do it in very small portions, especially when you're experiencing morning sickness. This way here, it's easy for the body to process, still getting the energy, but in small doses every 2 to 3 hours or so. That 2-hour mark is something where you might find that it's really beneficial because typically most people, when they eat food, there will be about a 2-hour cycle up and down with the blood sugar. So if you stayed around that 2-hour mark and you're eating small quantities of food that are really like good whole foods, then they've been shown to be very effective at minimizing morning sickness. Also, try to get extra sleep. One thing that tends to be problematic is that your body is using energy at a much higher level, and if you can't get in naps, then you're going to become more prone to have to start tapping into your stress hormones. And when your stress hormones come up, so does your blood sugar, and then it drops because cortisol releases floating blood sugar. It messes with immune function, and it can cause a lot of instability in the way that your body's able to go and regulate energy. So if you can get in naps, it minimizes how much you have to use your adrenal glands on a daily basis, keeping your adrenal glands, cortisol levels, adrenaline levels somewhat in check. Okay, so that's a really big one. Other tools that you can utilize, one thing that has been found to be very effective is taking iron phosphate. Safe, and has been proven very effective in improving symptoms of nausea and vomiting during the course of pregnancy. So if you are not under the care of a Webster certified chiropractor, I would strongly encourage it. As we go through, I'm going to talk about a number of different reasons why, but let me go through and just explain this because this is a lot of what we do. Myself, Dr. Brandon, and Dr. Lehner, we are all Webster certified chiropractors. And so Webster is a technique and a system that is designed to help with a number of different things for mom. It became very popular in midwifery settings and in settings with like nurse practitioners and people that work in the delivery world because of the fact that if a mom has a baby that's in a breech position, many times what that will have happen is that when a mom gets Webster, if the baby's in a breech position, it creates space for the baby to turn on its own. So versus like when a mom has an external cephalic version where the baby is turned by force, if we can keep the pelvis and the structures around the pelvis balanced, it gives the baby oftentimes the freedom of movement that it didn't have to get into an optimum birthing position. So Webster became very famous because it has a pretty high success rate around 80%, showing that if a baby's in a breech position, about 80% of the time, if caught early enough, the baby will turn into a normal birth position. So this is just something to kind of keep in mind. Now, reasons why this becomes important is twofold. Number one, it calms down your nervous system. When you get adjusted, if you've never been adjusted before, one of the things that everyone says, whether they are pregnant or not, is they feel more relaxed when they get the adjustment. There's a profound effect on the brain where it takes it out of fight or flight mode and puts it right into rest and digest mode. That's where we want the nervous system to be during the course of the pregnancy. So this becomes a big deal. It increases our brain's ability to adapt to the stresses that we experience on a daily basis. And there is probably nothing more important than that statement for the health of you and for your baby throughout the course of the pregnancy and for the health of the baby's neurological development. Now, we talked about Webster and its ability to allow for growth. And the reason this becomes really important is because during the course of the pregnancy, there are a lot of different things and a lot of different stressors that the body is under. So when we look at things like posture, simple things like posture changes become a big deal because every single day, your body is adapting to gravity differently. Your belly grows a little bit, your breasts grow a little bit, your center of mass shifts, the curves in your back are changing. And so all of the alignment that you're used to is going to be altered literally on a daily basis. And every day your brain is trying to find ways to compensate for this. And as you see, even on the charts here, right, there are all of these postural changes that are going to occur during the course of the pregnancy. So you can see on the right side, right, you've got the increase in the thing they call the lordosis, which is the curve that goes in on the lower back and the curve on the neck, and the kyphosis, which is the curve of the middle back. So there can be an increase in pelvic tilt. And you start seeing things like muscles that are already stretched become weaker. And you start seeing a tightening of the short muscles on the back. Lots of issues that can really affect the way that your posture and alignment are going to be affected. Now, a couple of things to keep in mind. There's a lot of proven benefits to getting adjusted during the pregnancy. And I want to spend some time talking about this because, you know, things like decreasing, obviously, low back pain is a huge one. You know, and I want to say this before we even move into the rest. One thing that I want you to keep in mind is that we are not doing any x-rays, whether it's us or anybody else that does pregnancy care. There are no x-rays performed during the course of the pregnancy. It's not safe for you. It's not safe for the baby. So every piece of care will be done based upon physical exam findings only. And all of the adjustments are generally known to be safe, regardless of if x-rays are performed or not, because of the way that these type of techniques have been developed. They've been proven over the course of millions and millions and millions of adjustments to be incredibly safe and incredibly effective for both mom and the baby. Now, some things I want you to think about, right? There's common things that we see time and time again that get relief during the course of pregnancy adjusting. So we tend to see that there is lower incidence of nausea, which is a big deal. A lot of moms who get a lot of heartburn tend to experience less heartburn. We tend to see improvements in things like constipation. You're able to breathe more easily because we're putting motion back into the middle back and the ribs, but also helping with alignment of the pelvis, take some of the stress off of the lower abdomen and the lungs. Tend to see improvements in things like hemorrhoids. We tend to see improvements in things like urinary function. When we talk about posture, right? So you see in this image, we see these things called the sacroiliac joints in the sacrum. Now, the reason that we have these in the image is because these are the areas that tend to be under the most stress during the course of the pregnancy. So maintaining proper posture and proper alignment in the thoracic spine, right? So this is where we see in this middle back area where they show the arrow that says kyphosis, curves of the spine. That's considered to be your middle back, right? The thoracic spine. So maintaining proper alignment of the thoracic spine can alleviate mid-back pain. And that's, you know, again, caused by increased breast size, but also increased curve of the lower back, pulling more into the middle back. And it can also alleviate shortness of breath and heartburn. Maintaining proper low back posture becomes a big issue because, you know, it'll help with things like, you know, alleviating stress in the pelvis, lower back pain, sciatica, frequent urination, constipation. You know, down in the center here, I want to go and put a quick marking on here so you can see this. Let me annotate this. This region, oh, let me step back. Let me show you quickly here. This region is called the pubic bone, okay? So right here between the two sides of the pelvis, there is just a piece of cartilage that holds the two sides together. There are no muscles that cross. That area is very susceptible to injury during the course of the pregnancy, and it can be simple things. It could be you stepped the wrong way. It could be going up and down stairs. It can be stepping off a curb. It can be a lot of different things that can cause this. This becomes problematic because it's incredibly painful. And so one of the things that we can do is we can adjust the pubic bone to get it back into alignment and proper motion, and it alleviates the pain of the pubic bone dysfunction pretty quickly. Now, when you look at things like the SI joints, so where you see the sacrum here and you see the pelvis coming together, so this region right here is called a sacroiliac joint. It's where it all moves. You see it also in this image right here. So that area is a place that is under a lot of stress because typically during the pregnancy, right, you have a lot of tension on ligaments that hold it together, as well as tension on the muscles. Well, every day the pelvis is changing alignment, and the secretion of relaxin is also increasing, which is going to put laxity into the ligaments, which makes you more unstable. So when we adjust you, the focus is to take the stress off of those areas, keep them in motion so that the SI joints and the sacrum and the lower back are able to maintain better alignment, because all of these areas here, all of these areas here, and this junction zone right here where the sacrum meets the lower back, because the lower back comes up from this area here, those all become high tension, high stress areas, as well as the pubic bone. So helping those areas sustain alignment and move better becomes a big piece of our goals during the course of a care plan. All right, guys, let me go ahead and clear out the markings on here, and then we'll get moving. So when we talk about things like alignment, right, it becomes more than just posture and low back. So there was a study that was done by Dr. Irvin Henderson, MD, on women who received chiropractic adjustments in their third trimester. Said that they were better able to carry and deliver their baby with much more comfort. Now, one of the reasons why this is important is because maternal subluxations, right? So areas of the spine and pelvis that have become fixated and misaligned are called subluxations. So maternal subluxations have bigger impact. If the pelvis is under torque, like we talked about, becoming subluxated, it can have implications for fetal constraint, okay? It can change the ability of the baby to move around in the uterus as it normally would have. And here's a couple of the big things you want to take from this. So pelvic subluxations can affect not only positioning, but spinal development, brain development, and the need for interventions during delivery, because here's what happens. So let me go ahead and mark on this for you here. So when you look at this, here's that sacrum right here that we talked about. This uterosacral ligament is attaching on the front side of the sacrum. So the position of the sacrum and the tension that it creates on that ligament is going to dictate the way that the uterus is going to be under tension. This round ligament here attaches right here to the front side of your pelvis. So what happens to the pelvis affects the tension on these ligaments directly. So if there is torque in the pelvis, and let me step back on the images here. Let me clear this off and step back here. So if we see that this part of the pelvis here that you see on the right-hand side, okay, excuse me, left-hand side of this, right-hand side of the screen, if this side of the pelvis torques backwards, okay, this side of the pelvis torques forward, then when it does, it creates a tilt here on the sacrum, okay? Now, that uterosacral ligament is coming off of the front side here on the sacrum and attaching to the back side of the uterus. So if there's torque here and here, then the sacrum is going to have a tilt. So it's going to rotate downward, causing this part to go forward. So it's going to put some laxity into this one, but increase the tension here. But then the round ligament, which comes off of the front side of the pelvis, which would be essentially right here, is also going to change tension, making the one side become a little more lax and the other side increase tension. So what this can do then is the longer that tension is there, it can have a number of different effects on tension on the uterus, making it more and more difficult for the uterus to stay balanced. Now, let me go ahead and get back to the other image. So if those ligaments are out of balance, it can create tension spots and torque spots where the baby's not going to be as free to move as it should be because there's uneven tension. Kind of like if you were to take your shirt and you take it and you wring and you pull on one side, then the other side becomes more taut, but the area where the tension is really, really, really under tension. So it's the same kind of principle where when the fascia and the ligaments are under tension, it can directly affect the ability of the baby to move around freely. So this becomes a really, really, really big issue when you think about pediatric care, okay? Now, I want to talk quickly about some of the health benefits of chiropractic during the course of the pregnancy, because these are things that, maybe you haven't taken into consideration, but I think you should. So there are benefits to both mom and the baby during pregnancy getting adjusted. Studies show that 50% of women have back pain during pregnancy with pelvis and SI joint dysfunction. So there was a study that showed a 50% decrease in need for painkillers during delivery, attributable directly to adjustments. So they found that not only was there a decrease in back pain, but there was also a decrease in need for the interventions during labor and delivery because they were able to handle pain better. So when you think about the impact of this, if we can keep your pain levels down during pregnancy, stress hormones stay down. We can also decrease the likelihood of the need for interventions during pregnancy or during delivery, which anytime that an intervention becomes necessary, then the potential impact on the baby goes up, right? Because one leads to another leads to another. So when you go down the road of having an epidural, then you're also going to have Pitocin. Well, if you have Pitocin, well, then the stress on your body can lead to then issues with the baby being able to transition, and it increases the likelihood of the need for a cesarean section. Well, then the cesarean section has its whole different set of side effects, which means increased force on your body and increased recovery times, and significant increases in force on the cervical spine, the neck of the baby. And we're talking like a 2 to 3-fold increase. So it's big, big numbers. So the lower the amount of interventions that are required, the greater the safety for you, the greater the safety for baby, but also the lesser impact on baby's developing nervous system, because if we have too much force put into the baby's neck or too much torque during the labor and delivery, it can lead to significant effects. There was one research study that I've reviewed several times here on our videos where they showed that the role of cesarean section was actually shown to be as significantly involved in the later onset of autism as cigarette smoking is to the development of lung cancer. That's why if we can avoid the more significant interventions by doing these preventative measures, then that would be the absolute best situation. If we can, help your body to be able to handle a natural delivery without the need for other interventions like epidurals and Pitocin, that would be even for the best, because now the body's able to do what it's supposed to be able to do naturally. So if you are in a position where you're thinking about that, you like to learn more about, natural childbirth and its benefits, talk to a midwife. Midwives, whether it's a home birth midwife, like we talked to Julia Meyer here in the Cleveland area, and she's a home birth midwife who's worked with many, many moms to successfully do home deliveries, and they have amazing experiences. Or there's hospital-based midwives, like we've worked with Sharon Johnson, who at the time was out at University Hospital St. John's West Shore at St. John's Midwifery, and it was an incredible experience from her as well. So there's a lot of different places in town here in the Cleveland area, but probably wherever you live, where midwives are really on the rise because moms are seeking better overall birth experiences than the heavily medically managed OB style, where they view it very much as an emergency. And so they're much quicker to go into interventions, whereas the midwife is more apt to try and minimize the amount of interventions to try and increase the likelihood that you're going to be able to go through and have a natural vaginal birth, or as few interventions as necessary to have a successful labor and delivery. All right, so let's keep on moving down here. So let's talk about things like posture. So moms, one of the big things that we really do want to be aware of is maintaining good posture early. And there's a lot of additional reasons why we want to think about posture. So when we think about posture, there are two additional factors that can create new and different stressors for the nervous system and the spine, leading to subluxation. Number one is daily gravitational changes. Number two, hormonal changes. So when we talk about daily gravitational, like we talked about this already, every day your center of mass is changing. Over 9 months, here's a few things that are going to happen. Number one, your stance is going to widen because your pelvis is going to go into a tilt, changing the way that your feet can work. You can't get your feet as close together, so it's going to be a little bit more of a waddling gait as you get further along. And if you've been through pregnancy, you know what I'm talking about. If not, if you've ever seen a mom who she gets further along, she starts to have a little bit wider stance. It's more of a waddling gait. That's why. Your low back curving increases quite a bit. Breast size increases quite a bit. These changes all lead to new stress points developing in the body that need to be addressed. And so knowing these things, the more your awareness goes to posture early, the more that you can minimize the stress on your body as it changes over the course of the pregnancy. Now, the other side is hormonal influences. And we want to talk about ways that we need to be aware of this. So relaxin is going to increase as the pregnancy goes on, along with a whole bunch of others. But relaxin is really the big one that we want to be aware of in terms of what it does physically. So as relaxin increases, your ligaments become more lax. So it's going to make it harder to maintain good posture. Your pelvis becomes more lax. Your pubic bone becomes more lax. You're going to subluxate more easily just because of the fact that you're now not relying as much on the ligaments, and you're putting a lot more stress into the muscles, and it becomes difficult for your body to maintain proper posture and alignment if you're not really super involved into this on a regular basis. So let me go ahead and let's start moving forward. So you see here in these slides some things about posture do's and don'ts. So you see on the part of the screen on the left with the woman who's laying on her belly, obviously it's a major no-no. It's really important that we lay on left side, and ideally with a full-length body pillow. And I have a slide later on of one of the ideal types of pregnancy pillows. When you sit, we don't want to cross our legs. Crossing your legs creates a significant amount of imbalance at the level of the pelvis. Now, we talked about subluxating the pubic bone. You can definitely do that by crossing your legs. But the other thing is that you can create an imbalance where your pelvis shifts that much. Remember we talked about that bone, the sacrum. So if you sit cross-legged like that, it'll create a pretty significant shift in the sacrum. The bone that you see down here on the image facing forward, it can literally cause it to become tilted by a solid inch or more. If your pelvis is under that kind of force, it can create significant issues with alignment of the pelvis, of the sacrum, but it also creates a tremendous amount of torque and another force called torsion, a twisting force into the uterus. So we really want to try and prevent and eliminate those things because of awareness. Now, when you look at things like the mom who is standing with a really wide stance, you don't want to do that either. You want to have a shoulder width type stance. We don't want to go and put our hands into the arch of our back. And that's one thing that a lot of moms do is they'll put their hands in the arch of the back. What that does, it exaggerates the low back curve, increasing the amount of stress onto your low back. So if you need to go and put your hands out for some support, go to the sides, not into the lower back, because you don't want to deepen the stress in the lower back curve. And then when you look at things like bending over, so you see in the picture on the top, the woman who's bending over with straight legs and all the force going into the lower back, that is a recipe for disaster for back injury for a pregnant mom. Because what it's doing is it's taking all of the weight of your back, all of the weight of your belly, pulling straight down in your lower lumbar spine and your pelvis. I've seen it many times that when moms bend like this, it really causes a lot of issues. So you see in the bottom row, right, we've got the mom laying on left side. And the reason is that there's a belief that if mom lays left side, it encourages baby to go into the proper birth position to have the easiest route to pass through the birth canal. If you've never heard this before, a lot of great information out there on it. You can look in Bradley books and hypnobirthing, Ida Gaskin books. A lot of them talk about the importance of laying in this position to optimize baby's position for delivery. So if you want to sit with your legs crossed, do it at the heels, where you're not going to create imbalance in the pelvis. Stand shoulder width and practice squatting. That squat posture is one where it'll keep your spine in alignment. You can see that the mom in that picture has a perfectly straight spine. Now, I also am a realist to know that that is not easy to get into. So if you're not pregnant yet, start working on doing things like a yoga squat. A yoga squat is exactly that posture. So yoga has been shown to have significant improvements in core strength. The more you have good core strength going into the pregnancy, the better your body will experience pregnancy. So things like the yoga squat before you become pregnant become awesome. Now, if you haven't done yoga, look into pregnancy yoga. And pregnancy yoga is a good one because it does help you during the course of the pregnancy at the trimester that you're at to do things to deal with spine issues, deal with core, help to make your body a little stronger, a little more fit. But you have to be careful, right? Because you don't want to go and add in a lot of new exercises when you are getting deeper into the pregnancy, because it becomes a new stressor for your body. Okay. Now, we want to talk about things like do's of posture, right? So we want to make sure that when you are standing, that you're standing with your feet evenly apart, knees loose and unlocked, shoulders relaxed and drawn back, okay? We want to imagine having a string pulling through our head, trying to pull us as tall as possible. And another thing to try and minimize things like heartburn, help with breathing is breathe through your belly. Now, what that means is you want your belly to expand, not your chest, when you take a breath. One of the easiest tools is learning how to do straw breathing, right? Where you inspire, breathe in by making a pursing of your lips like a straw, and only allow your belly to expand. So here's what that looks like. When you breathe like that, you don't want your chest to go up at all. If you've never done this before, or you find that you're breathing in reverse, one of the best ways to start is hand on chest, hand on abdomen, and practice not letting the hand on the chest rise. Those are things that you can utilize immediately that can be tremendously beneficial. A couple of things that we really want to focus on avoiding. Now, we talked about avoiding crossed legs, okay? We talked about avoiding hands on your hips. We also want to talk about shifting into one hip. Now, this is something that many people do somewhat subconsciously, but if you're one of those people who, when you stand, you actually shift into one hip like that, that is a recipe for some significant pain, especially as you get further along into the pregnancy, because it does cause significant imbalances in your pelvis, your sacrum, the lower back, stress in the hips, so on and so forth. I've seen many moms in my years in caring for pregnant moms, which is many hundreds of moms we've cared for now, that is a big issue that we have to eliminate. So keep that top of mind to avoid that. If you start feeling like you need, that you want to shift, shimmy back and forth. The movement oftentimes is what your brain needs. And if you shimmy back and forth, that movement will calm your brain, decreasing the desire to try and shift into one hip, okay? If you're already there and you're experiencing discomfort and wanting to shift into one hip, make an appointment right away to go and see a chiropractor so that you can get this issue resolved, because there's already a problem that exists, okay? All right, if that was helpful, do me a favor, let me know. Hopefully that gives you some insights into this. Let's talk about exercise, because obviously, like looking at, actually, let me spend a minute on this. I want to talk about seated postures. So this is actually a big one here, because when you talk about seated postures, we do not want to sit in the postures, whether it's on a couch, in a chair, where we've got our low back rounded out. Substantial amounts of force go into your lower back when you do that, but also puts a lot of constraint onto the baby. You see in the picture with the mom who's sitting on the physio ball. With her sitting wide stance on the physio ball like that, it requires her to use her core more, okay? So that is a very good thing, that she has to use her core. She's sitting shoulder width apart, give or take, with her feet. Now, one thing when I saw this that I wanted to point out is you do see that she is in a heel. We don't want to wear heels during pregnancy, because what that does is increases pelvic tilt and force into the lower back. You want to wear flats. So if you're someone who loves heels, I'm sorry, I love you, I understand, get rid of them. During pregnancy, you don't want that kind of force, because it will lead to a lot of issues with your lower back potentially during the pregnancy. But the stress that it will increase in your lower back can actually lead to areas like lower back degeneration that can lead to a mobility or translation forward to parts of the spine that can become a huge problem later on in life after your childbearing years. So I would encourage you to do what you can now to protect your spine, because having babies is an amazing thing. It really is. But you want to protect your spine so that during the course of the pregnancy, you're protected, the baby's protected, but also think afterwards. If you don't take care of your body during the pregnancy, your body's going to really struggle to recover from it afterwards, and it can lead to effects in the body that can literally last you a lifetime. So let's drop down here to this next one. This is what I was talking about with that pillow. And I want to make sure that we talk about this, because these kind of pillows are really great, right? These pregnancy pillows allow you to get into a position where you can hug on the pillow, keep your spine completely straight and neutral, keep your neck neutral, keep your shoulders neutral. As I'm sure many of you have noticed, when you sleep on your side, if you're kind of torqued, it can put a lot of stress in the shoulders and your lower back and your neck. In a situation like this keeps this mom very neutral. There's no torque, no twisting in her pelvis, no torque in her chest, no torque in her neck, with the exception of a slight head tilt, which, not ideal, but relatively close. So these are things where we want to try and make sure that when we are in a sleeping position, that you're essentially kept straight, whether you're standing or sitting or sleeping. And these types of pillows are tremendous for when you sleep to keep you in a neutral posture. All right, let's go ahead and move on. Exercise during pregnancy. So let's talk about this one. Regular exercise during pregnancy. It's an awesome thing to do. If you are already exercising, then you can go through the entire pregnancy and do it with only slight modifications. There are a lot of benefits to exercising during pregnancy. One being increased energy. Number two, more restful sleep. Number three, lower stress levels. Number four, better mood stability. Number five, women who exercise gain 21% less weight during the course of the pregnancy. Number six, better overall mood and attitude during pregnancy. Stress hormones staying down. Number seven, 80% of women who exercise regularly gave birth on or before their due date. Number eight, moderate exercise increases placental function and growth. That's a huge one. You want a strong, healthy placenta that's able to go and pass blood and nutrients through to the baby at an optimal level. Now, conversely, if you're exercising too hard, it can actually shrink the placenta. So we want to make sure that we have a nice balance point where we're, exercising, but not overdoing it. So everything within balance. It also increases oxygen and blood flow to the baby's developing brain. And that goes back obviously to placental function. So these are all things that help to optimize baby's growth and development, but also helps to go and maximize your body's response to the course of the pregnancy. There are some changes to the cardiovascular system of a pregnant woman that I think it's important that we talk about. You have a 40% increase in your blood volume and an average increase of 15 beats per minute in your heart rate. So exercising during pregnancy helps to improve cardiac efficiency. One thing you want to keep in mind is you want to be very aware of your heart rate. You want it to go no higher than 140 to 150 beats per minute. And if kept in this range during exercise, it has numerous benefits for both yours and baby's health. You want to limit moderate intensity cardio to no more than 15 to 20 minutes per session, and low intensity cardio to no more than 45 minutes per session. And make sure to drink plenty of water. This is a big one. Too little water thickens your blood and can cause a buildup of toxins in the blood, but it can even lead to blood clots. So we want to make sure that we're drinking at least 100 to 120 ounces of water per day because it keeps the blood at a relatively thin state. So think of viscosity, right? They talk about fluid viscosity, oil viscosity. The lower your water intake is, the thicker your blood becomes, the greater the viscosity of the blood becomes. And it creates a whole problem because now thick blood equals potential for clots, but it also makes it more difficult to detoxify. All of these things become problems for your body. Now, contraindications to exercise are things like high blood pressure, cardiovascular disease that's pre-existing, vaginal bleeding, preterm rupture of membranes, history of incompetent cervix, premature labor, fetal complications, anemia, diabetes, sickle cell anemia, and thyroid disease. So there are a number of different exercises that have been shown to be very, very beneficial during pregnancy. So number one is an exercise style called birth fit. And I'm going to jump to a video so you can see this in a minute. Walking, swimming, stationary bikes, water aerobics, pregnancy yoga, and of course, other pregnancy exercises classes that are devoted towards, helping mom's body to stay strong and fit. And even like the stretching component of yoga can be very beneficial because you will notice you feel tighter. Your body's going to require a little bit more maintenance than normal. So the more you think preventative maintenance, the better that your body will function during the course of your pregnancy. So I want to show you this quick video here because, Birth Fit is an exercise program that was actually developed specifically to help moms to be able to go and have pregnancy safe exercise depending upon where you are. So I'm going to let you watch this video. Hope you enjoy.
What is Birth Fit? Birth Fit is a fitness program. We focus on holistic prenatal and postpartum training programs that enhance your awareness within your body, around your body, how you are moving, how intentional you are, how you are breathing. Above all, we do fitness top notch above all the rest because we have an extensive background and education and experience in rehab, in rebuilding. That's Birth Fit.
So I'm going to pop out here before we wrap up. So the reason why I think BirthFit is actually, it's because it's an exercise program that was specifically created by doctors to help you to be able to go and have exercise that is appropriate. And I know that promo is a pretty cool one. She's a great lady whose heart and passion is for you pregnant moms to have the best exercise, health, prenatal, postnatal experience possible. So moms, we've gone through a lot today. I hope that you've been able to go and take things that you can apply into your own life so that you can maximize your experience with your pregnancy. Now, what I'd like you to do is if there are things where you have more questions, and here's the end of the part one. If you have questions about what we've gone through, drop your comments in here on Facebook, or you can send us questions directly in through Facebook Messenger, or you can go to elitefamilykairos.com and send us messages through there with your questions. Now, what we'll do is we'll go through and we'll get back to you with your answers via email or however you contact us. But if there are questions that we see a lot of, what we'll do is we'll also answer them in part two. Part two is also going to be loaded with content. There's several other sections that we still need to go through as it relates to self-care, because in the next upcoming, we're going to talk about things like caring for abdominal separations, diastasis recti, tummy and breast care, treating your feet, taking herbs and homeopathics, visualizing your ideal birth, stimulating your baby, discussing your ideal birth, your hopes and fears, invest in rest and sleep, focus on meditation and music, attending birth classes or workshops, and of course, obviously hydration. So there's a lot yet to come, a solid half an hour to an hour worth of content still yet to come as we come up with part two, which will air now 2 weeks from today. So let us know what your questions are. If you got value from this, drop a like. If someone that you know will also benefit from this, share this with them, okay? Make sure you download the notes page and make sure that you're giving us your feedback on what we can do differently, what we can do better, areas that you'd like us to improve upon, because we're doing these for you moms. We're doing these so that you can get the best pregnancy experience possible. So this is Dr. Scot Haggerty. I thank you so much for being a part of this webinar with us today. And hopefully this advanced training gave you some great resources, and I will look forward to seeing you in part two in 2 weeks.